does a multicellular organism get the message throughout the body? And it utilizes two primary systems. One is the endocrine system, okay, and the other one are the nervous system. And let's just kind of look at the difference between the two. The endocrine system, typically you're going to have some endocrine cell, maybe an endocrine organ that's going to secrete these hormones, and the hormones are going to be picked up by the blood system, and the blood system goes throughout the body. So you're going to be able to deliver these hormones throughout the body. The drawback and the positive is that you don't want it acting on every single cell of your body. So where that hormone has to act on, only those cells that have receptor sites on them are going to be the ones that respond to that hormone. Okay? So the way it's linked up is through the circulatory system, and the response is only to cells that have receptor sites on them. Okay? Let's contrast that with the neurological system. So the neurological system is going to go through the nerves, right? It can only go where things are sort of wired up. Which one do you think can deliver the message faster? Yes, right. The neurological system can go really fast. So it's a highway, it's quick. We're going to talk about these electrical changes that take place in order for the electrical system to occur. So you have to have a bunch of nerve impulses that are going down. Now the neurological system is only going to influence where it is attached. So the targets have to be innervated. They have to have the nerves going to them. So that's the way they do it differently. Okay, so the differences between the two: wider distribution, a little slower to react, right? And it reacts to cells that have the receptor sites. Fast distribution, very fast, but it can only go to those particular cells that are pre-wired up, okay? And so you have that. So targeted cells are virtually attached to the neuron. And we say virtually attached to the neuron because neurons have little gaps between them, right? And then there's neurotransmitters, and we're going to talk about that when we get to the neurological system. But this is basically the two different ways. And it's not an either-or situation. It's going to often be both. It's going to, if the body needs to react quickly, but then it needs some more long-term assist. So, and sometimes you have a combination where the neurological system is going to innervate into that gland, or responding gland. All right. Okay, so we're going to study both of those in detail a little later in the course. So let's take a look now at different animals and how they regulate themselves in the environment. And so here we're taking a look at two different types of animals. Here we have this nice little river otter, and here we also have this largemouth bass. And we're looking at the ambient temperature, that's the temperature outside, and what happens as the temperature increases to the largemouth bass? What happens to its internal temperature? It increases. So it is a conformer, and we call this, so this is a thermoconformer. So as the temperature goes up, so does the bass's internal temperature. But what happens to the river otter as the temperature is increased? It maintains it to a certain degree. Okay, so let's look at some of the advantages and the disadvantages of each of these. So what might be an advantage of it just going with the environment? Yes, that is the biggest advantage. So if you think about how much energy we utilize to keep us at 98.6, that's a lot of energy, that's a lot of food we have to eat. Whereas this other organism isn't going to have to use that very, very large energy budget for regulation. However, if, when temperature changes, response times change. The ability to live under different conditions can change as well, so that might be a drawback. So although this largemouth bass might not have to eat as much, per gram as the river otter, it is going to possibly not be able to live at more extremes. So there's advantages and disadvantages of both. Okay. So the other thing is we want to talk about how do we keep our bodies, particularly regulators like us, how do we keep our bodies in this nice homeostatic range? So we do this through these negative feedback systems, and here's just how a typical negative feedback system, kind of looking at the heat in the room, although the heat in the room just seems to get hotter and hotter. I don't know why. We've tried to fix it. So let's say your body, or in this room, we have a set point. We want it to be at 20 degrees centigrade, and the room temperature increases. What will happen? The heat turns off, and then the temperature will go down. And if it gets too cold in the room, we have the thermostat set, and it's going to then turn on. So the fact that the negative thing happens, in order to get it to that regulatory stage, we call that negative feedback. So here's the realm, and you can think of a body, this is the homeostasis. Things get a little too high, we want to shut that system off, so it brings it down lower. Things get a little low, we want to bring it up higher. And this is looking at it for just heat maintenance, but we do this for everything. We do it to maintain our pH, we do it to maintain our glucose levels, we do it to maintain different hormone systems, blood levels, everything. We have these feedback systems. So let's just take one example. Since we started out with the heat, we'll use the heat in the body. And so here's your normal body temperature. So it's 36 degrees centigrade or 98.6 degrees Fahrenheit. When the temperature increases, there's a lot of feedback systems that are going to allow the body to cool down. We get these responses through the brain. We get the dilation of our blood vessels. So the blood vessels, what we call the superficial blood vessels, open up. Because we don't have blood going through fully all of our vessels. If we did, we would go into shock, because there's not enough blood for all the blood vessels we have, so we kind of regulate it. But when it's very, very hot, we open up the superficial ones, the ones on the outside, right? And that allows, just like the hair with the veins and going through the ears, it allows more heat to go out, right? And then we also start sweating, so you get this evaporative cooling, and that'll help bring down the temperature. So, and if we get too cold, we do some other responses. We shut down, we close down the superficial vessels, and we start to shiver, and we're utilizing energy, and so that's creating heat, and so our body temperature goes up. So that's keeping us there. So just a couple of quick things. If you're ever skiing, right, and you get cold, where does it get cold first? Anybody? Or you're out in the cold, your hands, your feet, things like that. Those are the superficial areas. And so somebody might go in and say, I want a drink of alcohol, because that will open up all these vessels that are there, all the the superficial blood vessels. But that's not the best response, because then what you're doing is you're bringing more blood to the surface, but your body core is losing that blood. So you really want to be careful of what you do. You want to sort of keep them warm. You want to go by the fireplace. But what you don't want to do is be out there and then counteract this, because when you're cold, you want to keep the heat in your body. You don't want to lose it. And alcohol will make the superficial blood vessels go. You see that you kind of get red or something if that counteracts that. All right, so that's a negative feedback system. That keeps us in a very tight homeostatic range. But there's another thing called a positive feedback system. Okay, now this is very different. Eventually, you want to get back to that homeostatic range, but there needs to be a job to be done. And so we get these cascading responses, meaning that the response is getting bigger and bigger and bigger till you get the event to occur. So the control mechanism, instead of if something is high, turning it off and lowering it, or if something is low, turning it on and hiring it, like the negative feedback, we want to build and build and build the response until our body gets done with what we want to do. So I put a few examples here. One very common one that people talk about is the birth of a child. Okay, so the child is in the uterus and it begins to hit up against the wall of the uterus, and it sends these impulses through the neurological system to the brain, and it says, okay, we're going to secrete more oxytocin, okay, and that's going to make the contractions go harder. So the contractions are harder, the baby's hitting up against harder, so you get a positive feedback. We're going to give more oxytocin. Oxytocin is going to cause a greater release and a greater contraction of the uterus, and this builds and builds and builds until the baby's born. Okay, and then you come back to the normal homeostasis. And you could see the same thing in an immunological response. Okay, so you have an infection. Your body wants to build the response, get those white blood cells and things multiplied, and they're, the immunoglobulins put out higher, 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 until you build up enough to get rid of the invading organism, virus, bacteria, or whatever. But then once it's done, you want to shut it off and you want to be able to get back into homeostasis. And we'll see the same thing when we talk about controlling of bleeding. It's a cascading response till we can do a job and stop the blood from, leaving. Okay, so those are a couple of those. So that's how you kind of maintain homeostasis. Also, the question I have in there, is there a particular set point? We were looking at these barriers, and there's particular set points that you're trying to get back into the range. But in reality, there's an area of acceptability. And then sometimes throughout the day, it changes. Your temperature changes throughout the day. When you first wake up, it's a little cooler. And then then it gets a little warmer. And also some different seasons, or depending upon what you're exposed to, there are alterations in the homeostatic ranges. So here you can just kind of take a look. Here's two different things that I want to look at. One is the body temperature. Okay, it's higher. You go to sleep at night, you don't need as much, you're under your covers or whatever. Your metabolic rate is lower, so your body temperature actually lowers, and then as you wake up in the morning, it goes up again. So the homeostatic set points different. They vary throughout the day. And so do different levels of different types of hormones. So in this one, what we're looking at here is the hormone that makes you tired, that makes you sleepy, which is melatonin. And so if you look at the melatonin levels, they're going to be low, right? And then right before you need to go to sleep, there's going to be a really big increase in melatonin, and that's going to make you sleepy and fall asleep earlier, okay, or just after that. And as you age, when you get this little shot of melatonin, and even the amount of melatonin shots that you get vary, okay? So when you're younger, very young, you kind of get an earlier shot, you go to bed earlier. When you're kind of a teenager or early 20s, your shot of melatonin is going to be a little later in the day. And so then you're going to fall asleep a little bit later in the day. We also have variations in how we can adjust, just during different seasons. So here's bunch of people, these climbers. What kind of variations do you think are going on in their bodies? Anybody want to give me some guesses? Yeah?
Less oxygen.
Exactly. So less oxygen is one. You're at a higher elevation, So your body is gonna say, we need more oxygen, and it's going to set, there's actually different hormones like erythropoietin, which will be given off and say, make more red blood cells. So it makes more red blood cells so you can capture more of the oxygen. In fact, anybody hear of, there's different kinds of blood doping? Anybody hear of blood doping? Yes, you have. You wanna mention what it is, or? Yeah.
I know where athletes will like take out some blood and then re-inject it before they have to do something so they have more red blood cells.
Right, so that's one of the ways that they're kind of blood doping. You're trying to get more red blood cells in there. Another one might be taking erythropoietin, or EPO as it's called, and that also increases the amount of red blood cells. But it's not a good thing to do, because if you increase the number of red blood cells that's appropriate, you're making the blood more viscous. And so you would see all these elite athletes, like particularly bikers and things like that, just have heart attacks or die because it's just not, it's bad to have this very thick blood that's going out. So a natural acclimatization is good. If you were playing if you were a football player and you were going to play up in Colorado, is it best to just fly out that day and then play the game? No, right? You want to get there. You want to maybe practice at that level. You want your body to adjust so you have more, more red blood cells, more oxygen, and things like that. So your body is more acclimated to work at its utmost under those conditions. And also these people are in a cold area, so they might be also producing more, there's brown fat or different types of fat that will keep them warmer as well.